Welcome back to the show. We are joined by the co-founder of Health Navigators, Liz Curran, joining us once again here.
Thanks for having me back. What we found over the years working with so many different people is that there are four things that we call them our four pillars to really make sure people have these solid before they dive into making lifestyle changes. Two other things that come up a lot before people can dive into lifestyle change is making sure that you have a really strong purpose. We do have strong reasons for living as a healing factor, but really looking within to find what is your personal soul's purpose? Like, why are you here on this earth? Because if you don't have a why, then the how doesn't really matter. You're not going to have that motivation to really dig in deep and make these big changes. And what I will say is I worked for a few years prior to working with cancer patients. I worked in a gym.
Yep.
And I worked out in different modalities of working in nutrition and helping people find their way into nutrition wellness. And they weren't as motivated because now working with cancer patients, they're highly motivated. They want to make change. Their why is that they want to be here on this planet. When you're working at a gym and someone wants to tweak their diet, they're not thinking about this is a life or death situation.
But if we all thought about that now, would we be in a better place? Because we're
100%.
proactive and doing. I mean, not to say that you get cancer because you're eating poor, but there's so many different factors, right?
Right. And there's so many things, even just later in life, having like strong mobility and strong cognitive health and longevity, being on this planet, feeling healthy and sane is so important. And you don't tend to think about that when you're younger. But if you can implement these 10 healing factors along your life, even if you don't start until you're, in your 30s or in your 40s, those things matter as soon as you can start implementing them. Really, a lot of it is strong mental health, which is great for your whole life. But I do really think that it's important to mix in some of these things as early as you can so that you don't end up with the diagnosis, because these things help with chronic illness. They help with autoimmune disorders. We've had so many healing stories, people with ALS, people with Alzheimer's, they have healed. And they are not typically things that you hear people healing from. And a lot of it, unfortunately, a lot of those kinds of things occur after really significant childhood traumas that people don't have the ability to release or the skill sets to release. So when they then dive into these factors and they dig deep into their emotional state and finding self-worth, self-compassion, their voices, their boundaries, their empowerment, until they can release the past, they can't have that free flow of energy in their bodies. And a lot of times that can manifest into illness. And obviously that's not to say that everyone who has had a traumatic childhood equals a disease later in life, but I do see a correlation between that and the people that I work with.
So it's been an honor. If someone wants to reach out to you, could you share again how we could do so?
Yep. Please visit us at healthnavs.com. You can visit us on Instagram and Facebook at Health Navigators, and on YouTube, we are at Health Navigators Official. And you can listen to our Radical Remission Stories That Heal podcast to hear healing stories from people who have overcome the odds of their cancer diagnosis or their life-changing diagnosis, and also healers who have worked with these people and have seen these at least 5 radical remissions in their practice.
All right. So if you want more good info, you want to keep following Liz and I, just click on the link down below.